Thanks everyone for being here. Before I hand it over to the more important people here, I wanted to, and we talk about vaccines and the effort that the city, Park New Haven, Griffin Hospital, along with federal support, are doing to facilitate vaccines here and in transit hubs around the state. I want to just take a moment to say that you're in a space that's going to dramatically improve thanks to the partnership with the state and Park New Haven over the coming years. Behind me, you're going to see an intermodal transit center being built to facilitate more bus access. We're going to improve some of the retail here so that we have more retail that reflects New Haven. No offense to Bar. And we are going to build on the other side additional parking, but also a liner building that has a more humane connection with the street as people walk up to the station. This station is going to be even more exciting than the beautiful space it already is. And if you have a moment, if you haven't gone up there yet, you get an idea of just how historic this station is and how beautiful it is. I'm excited to be here among so many partners that are helping us fight the virus. New Haven, I'm really proud of the way that we have responded to the pandemic. We've done it following the science, we've done it with compassion, and we've done it working with each other. And you see some other communities across the nation that are fighting about mask mandates, about undermining the science around vaccines. New Haven has done just the opposite. We've stayed the course, we've supported each other, we've understood that in these times that are difficult, it's important for us to sacrifice a little bit of our own convenience in order for the greater good and the health of so many people that are vulnerable in our community. Our test positivity rate at this moment over the past 2 weeks is 2.3%, which is good compared to the rest of the state. And we've just gotten updated information on the percentage of New Haven eligible population that has been vaccinated, because it now includes the 5 and up age as well. And we're at 63.24% of the eligible residents that have been fully vaccinated receiving those 2 doses. So that's really good. We still have a lot more work to do though. And especially with Omicron and the increase in spread around the state and in the region, please get vaccinated, get your boosters, and that's what today's about. I'm going to hand it over to Congresswoman DeLauro. Thank you for being here.
Thank you. Thank you. Thank you very, very much, Mayor. I'm delighted to be in Union Station. I spend a lot of time in Union Station, and it's a great and wonderful place. As a matter of fact, just got off the train, and we'll get back on the train at 11:16 to head back to Washington. But Mayor, I want to say a thank you to you for your introduction and for your understanding that as the winter approaches and the holiday season begins, it is never more important to get vaccinated, and if you get vaccinated, to get a booster. And it's really impressive about your 2.3% and the work that you've been doing here in New Haven. I have to acknowledge Governor Ned Lamont, thank him for being here and for his leadership and his strength throughout this pandemic. And on Saturday, the first confirmed case of COVID-19 Omicron variant was detected in Connecticut. Sequencing performed at the Connecticut State Public Health Laboratory confirmed the presence of the variant in a resident from Hartford County. As Governor Lamont has been saying for several days now, this is likely not the only case of the variant in our state, but he is right to urge everyone not to panic. He has prepared our state well with the life-saving tools like vaccines and boosters that are necessary and available to protect everyone and fight this pandemic, which includes both the Delta and Omicron variants. Now it is up to all of us to take the necessary precautions to protect ourselves and everyone around us in our communities. Let me give special thanks and a shout out to our Public Health Commissioner, Dr. Jutani, whose team of epidemiologists under the direction of Dr. Matt Carter, Dr. Lynn Sosa, were able to complete this case investigation in a timely manner, taking just 1 day to confirm it as Omicron. Dr. Jutani's work is helping to keep people out of the hospital, reducing the morbidity and mortality of COVID-19, and as she put it, and I quote, is a win for vaccines in our society. I was encouraged to see that after the Center for Disease Control and Prevention, their announcement last month, when eligibility had been expanded to all adults, Governor Lamont and Mayor Elicker stepped up, along with so many New Haven city officials gathered here today, took it upon themselves to get out the word and urged all Connecticut residents to get their COVID-19 booster vaccine. Let me also recognize our Lieutenant Governor, Susan Bysowitz, a partner with the governor in making Connecticut a model for the nation in this area. The Director of Health for the City of New Haven, Maritza Bond, Doug Houselating, Park New Haven Executive Director, and Union Station is under his jurisdiction. Of course, Pat Charmel, who is steadfast resolved through this pandemic. The work at Griffin Hospital has continued to serve our community. You've met the needs of so many seeking care during these challenging times. We're grateful for your leadership and partnership with Governor Lamont and the Connecticut Hospital Association to continue to educate the public about the dangers associated with delaying care due to COVID-19 fears. And I also want to recognize Senator Richard Blumenthal, who was with us this morning as well, and who obviously has an interest in what we're doing here today. So I want to say thank you for being here, helping us educate our community about getting vaccinated. And for those who are already vaccinated, receiving the COVID-19 booster vaccine, this is how we get COVID-19 cases under control. We all know the numbers. On Thursday, Connecticut reported a positivity rate of 6.52%. It was the highest in a single day in more than 10 months. It dropped on Friday, I might add. But that still means that the recent spike is intense and that we have to deal with it. And as I said a few minutes ago, whatever the up number or the down number is, our state, our governor, our lieutenant governor are leading the way across the nation in being able to get ahead of this effort. Connecticut has one of the highest vaccine rates in the entire country. We have a long way to go, but what we do know, as the COVID cases rise, the data shows that it is the unvaccinated that are driving this surge. The best weapon against the virus is getting vaccinated, and that includes a booster. We're here today, Union Station, the COVID-19 vaccine clinic upstairs. You know, this is the busiest Amtrak station in Connecticut. It is the 10th busiest Amtrak station in the country, boarding or detraining nearly 2,000 passengers every day. And they're here to encourage everyone in our community to get their COVID-19 booster vaccine or to get their first or second dose. And it was wonderful to see the service dogs here as well this morning. I want to applaud the Connecticut Department of Public Health for organizing these pop-up vaccine clinics in major transportation buildings like Bradley International Airport and Windsor Locks, the Stamford Transportation Center, and of course, right here at Union Station. It's open every day, 8 to 3 p.m. It will move, it started November 24th, will go to December 29th. This is the best way to ensure that travelers coming in and out of Connecticut are vaccinated and ensure that we get this pandemic under control. But it's not just for the travelers. The clinics are important for so many of our union brothers and sisters who are the essential workers here at Union Station. I think about Pete, who I see every week in the information office there. Having the clinics here and other major transportation stations, it's critical to take care of those who put themselves at risk every day to keep this country moving. So far, Union Station has administered more than 58 COVID shots, 45 booster shots, which launched late last month in partnership with the Connecticut Department of Health, Griffin Hospital, the City of New Haven Health Department. Additionally, this partnership has hosted more than 700 pop-up clinics throughout New Haven, has administered over 8,000 COVID doses. New Haven's Health Department actively works with both the Connecticut Department of Health and Griffin to identify high-need areas, and together the schedules and host vaccine clinics at local libraries, schools, businesses, and churches. The pop-up clinics are critically important. And as the commissioner said, we've got kids 5 to 11. They have their own vaccine clinics. We have other clinics for ages 12 and up, and dealing with adults as well. They're on a walk-in basis. No appointments needed. Ages 18 and up need to bring a photo ID, insurance card, a vaccination card if they have them. But the City of New Haven has made it clear, no one will be turned away for lack of insurance. That's important. They're going to vaccinate all eligible residents regardless of immigration documentation status to protect their public health and well-being. With that, I urge everyone, do your part. Do your part. Help end this virus. Get vaccinated if you have not already. And to those who have, get your booster. And thank you, and all stay safe. And now it's an honor for me to introduce the governor of the state of Connecticut, Ned Lamont. And once again, thank you for your leadership, not only for the state of Connecticut and the country. Governor.
All right, Rosa. Thank you, Rosa. And, thank you, Rosa and Dick and the entire congressional delegation. What a difference the infrastructure bill is going to make for this station and our state and our country. I think you heard Justin describe a little bit about the transformation of this historic Union Station. I'm looking over there at the train departures. As we upgrade our rail system, you're going to be able to take 10, 15, 20 minutes off your commute in each direction in the none too distant future. Kind of happy to see everybody up there is on time except for Boston South Station. I can't control Boston, but everybody else is on time, and what a difference that makes as we speed things up. I'll be done in a second. I wanted to say about these boosters. I mean, okay, Omicron, and here we go again, and another variant. There's always going to be another variant. There's always going to be a faster gun. Certainly until we get the rest of the world vaccinated, the likes of which we see here in New Haven, and we're not there yet. It really gives you a new meaning that when we say we're all in it together, it's not just the lyrics to a John Lennon song. It really shows that if there's a new variant in Southern Africa, it will be in Connecticut by the end of the month. And this is what it means to be working through this together. But I don't want anybody getting down on where we are. Our infection rate is up. It's up at 5.8% over the weekend, 5.8% for the week. Lowest in the region, big deal. The region is popping up. It's coming down from New Hampshire, coming down from Massachusetts and upstate New York. Delta is, and we're assuming the Omicron is coming up perhaps from the other direction. You saw that it was at the convention center in New York City where this was detected. What you gotta appreciate in all the scientific back and forth, they get me confused too. How effective is the vaccine? Is it 97 or 94%? Here's what you gotta know. You gotta know that maybe with each of these variants coming along, we can't always prevent mild illness. But you gotta know that the boosters and the vaccines are keeping you out of the hospital and are keeping you out of the morgue. It is amazingly effective when it comes to preventing complications. And that's the message you got to give to all your friends and family. The message you got to remember why it's time to stand up. As you heard Rosa say, look, some complications, CVS, do I need to get an appointment, and talks about insurance card. Not here, not at this pop-up clinic. If you haven't been vaccinated, if it's been a long time since you got your booster, come right up here. If you got identification, all the better. If not, no questions asked. You're doing the right thing for yourself, right thing for your community, right thing for your city, and right thing for the state. And our boosters are going up a lot. You know, we're in the top 10 now. 5 to 11-year-old kids, top 10 in the country. We can do better. Let's be number one and put a wall around us, do the best we can to protect ourselves from whatever Mother Nature sends our way next. And with that, Susan, who am I introducing? How about Susan Beisowitz?
Okay, all right. Governor and Commissioner Giussani, thank you so much for everything that you have done to keep our residents safe. We are now gathering and entering the winter months where we will be having holiday parties and celebrations. And so as we prepare for that, it's really important with Christmas and New Year's coming up that we spend time with each other, but we do it in a way that is as safe as possible. And so we're facing rising positivity rates in our state. We're also facing a flu season. So it's important that we protect ourselves and that we get a booster. So I went to a walk-in clinic in Cromwell on November 4th and got my booster. They gave me this great little plastic card to put my vaccination documentation in. And right over there, if you walk up, a lot of the clinics are providing these plastic cases for your vaccination card. Now's the opportunity. And it is not just a matter of safety, but it's also a matter of equity. And one of the reasons we're here in New Haven is to highlight how important it is for every person, particularly those in communities of color who are vaccinated at lower rates, to get vaccinated. And at walk-in clinics, you don't need any documentation. It's great if you have your card, but you don't need that. You don't need insurance. The vaccinations are free right here, and Griffin Hospital is going to be here till the end of the year, boosting and vaccinating people. So our message today is please to keep your friends and family safe, to keep our essential workers safe, and to stop the COVID variants. We need everybody vaccinated and boosted. And with that, it is my great pleasure to introduce our United States Senator, Richard Blumenthal.
Thank you. Thank you. Thank you. Thank you to Susan Bisewitz, who has really been a champion of public health in this state, and to the governor, who has led the nation, and maybe most important, to my wonderful colleague, Rosa DeLaura, who has really helped to lead the Congress in moving us forward. She almost single-handedly has moved the entire Congress to caring and acting more about public health in our entire nation. Both the governor and I got our booster shot at the Durham Fair, and it was done by the wonderful public health workers at Griffin Health. Thank you to Griffin Health for your great work all around the state. Wherever I've gone, I've seen Griffin Health. I have a very simple message because I'm going down to Washington, D.C. Our Congress needs to get off the dime, pass the Build Back Better measure so we can extend the enhanced health benefits for all of Connecticut and all of the country. The savings are stupendous as a result of the American Rescue Plan. $1,400 per person, $6,000 for eligible new enrollees. Yes, the booster and the vaccine are available free, but expanded health care is essential to helping people avoid the comorbidities, whether it's diabetes or obesity or respiratory afflictions that lead to enhanced infection results. And let me just close by saying that this kind of clinic is the key to outreach, and nothing is more important than outreach. It is a matter of racial justice. It's a matter of equity for every single Connecticut person, that all of us be safe. This variant is only the latest. Omicron is one of a series. It's a preview of coming attraction if we fail to get vaccinated and use the booster. As long as this virus is spreading, it will be mutating, and it's eventually going to find a way to defeat the vaccine and booster unless we act promptly and effectively to get everybody vaccinated around the world, not just here in the United States. And that's why efforts by Congress right now are so important to spread this word, to make the vaccine available, and to encourage people to overcome whatever hesitancy, doubts, disagreements they may have. It's time now. Celebrate the holidays by making yourself safer and making everyone around you really enjoy the holidays with a feeling of safety. Thanks so much. And now I'd like to introduce our wonderful Public Health Commissioner, Commissioner Giussani.
Thank you very much, and I want to thank all of our elected officials behind us here today that are helping Connecticut emerge from this pandemic. It's not over because the virus isn't done with us yet, but we have so many tools in front of us now that we did not have a year ago at this time. And because of that, we're in a better place to be on offense, to be able to take charge of this situation and try to protect ourselves. Over the last month, we saw Connecticut go from 61 towns, originally 31 towns that were red, that then went to about 67 towns that were red, to 101 towns, to 137 towns. The bottom line is the virus is among us, predominantly the Delta variant still. And this is resulting in hospitalizations in our state where 70 to 80% of the people in the hospital are unvaccinated. The virus finds the unvaccinated. If you have been on the fence, this is your moment this winter to protect yourselves and your family and protect yourself from getting into the hospital. As the governor accurately pointed out, there is always going to be the emergence of variants as we have unvaccinated people in this world. And our world is so interconnected now that what happens on one end will arrive at your doorstep in a matter of weeks. Omicron is the letter O in the Greek alphabet. That tells you how many variants we've had so far. We started with Alpha, that started at the beginning of 2021, coming from the UK. The Delta variant is the one that has overtaken most of what's causing our problems right now. We have to remember, we may hear about Omicron, but the Delta variant is still very much here. It is what is causing most of our problems right now and resulting in severe disease, particularly in the unvaccinated. There were several other variants along the way that didn't cause much problem for us. We have a lot to still learn about Omicron. We don't know what kind of impact it's going to have. Luckily, for our first few cases here in Connecticut, it seems that it has been mild disease so far. That is welcome news. If we convert this disease into something where you cuddle up in a blanket if you're vaccinated and stay home for a few days and then get better, that is a success of the vaccines. That kept you out of the hospital and that kept you alive and well with your family this holiday season. I know some people have said they have had a hard time getting boosters. Anybody 18 and older is eligible for a booster. And because of our partnerships, we have pop-up clinics just like the one here at the New Haven train station. We have at the New Haven Library, the Trumbull Mall, the Stamford Station, Bradley Airport, and many others around our state. All you need to do is walk up and get your shot. This is your chance to boost your immunity. The immunity that you get from a booster starts immediately because your first 2 shots got you to a certain level. Waning immunity just means that it's slowly coming down with time. When you get your booster, you start going back up right away. Every day after that booster, you are that much more protected. You are not wasting any time at all by getting that booster. So I want to encourage everybody to remember, vaccines are our way out of this pandemic. Whether your town has a mandate or not, masks are going to protect you. Continue to wear them when you are around people you do not know and you do not know their status, and if you are around large groups of people. Large groups of people are when you can have a lot more potential for transmission. Just more people, more potential for virus. So let's get through this season by protecting each other so that you're not sick and have to stay away from your family during this holiday season, and in fact can celebrate with them, celebrate the coming of this new year and a time for more hope as we begin the new year. Thank you very much. I'd like to now introduce Griffin Health President and CEO, Pat Charmel.
Give it to Mr. Armel. Can you imagine?
Thank you, Commissioner. You know, it's been 19 months since COVID entered our state. 19 months. This has been a marathon. And I know we're all tired. And we're losing focus. And now's the time to redouble our effort. This is a marathon. We're at mile 25. And it's when most people drop out of the marathon. We can't do that. You know, we have over 600,000 adults that are eligible for vaccination in Connecticut that haven't been vaccinated. You heard the mayor talking about the vaccination rate in New Haven, and it's something to celebrate, but we need to focus on those that are not vaccinated. What we're seeing right now in the increase in hospitalizations over the last 2 weeks, there's been an 80% increase in hospitalizations. That's not because of Omicron. That's because of the Delta variant that's still with us. We don't know the impact of Omicron. 91% of the hospital beds in New Haven County are full today. There are only 200 beds left to be filled. We need folks to go out and protect themselves because they are protecting the community, but they're also preserving our capacity to take care of sick people. We didn't hear a lot today about seasonal flu. Luckily, we didn't see any seasonal flu last year. We've seen the first cases of seasonal flu already in Connecticut over the last 2 weeks. Think about how many people get hospitalized due to seasonal flu every year. Layer that on top of what we're dealing with. So we need people to go out and get their seasonal flu vaccine, get vaccinated if you're unvaccinated, and get your booster. Those people who have been on the front lines for 19 months need your help. Because frankly, there isn't the capacity to handle what could come if we don't do the responsible thing. We're glad to be here at Union Station, right? See those large flags and those yellow cars? They're all across the state. You can drive up, you can walk up, you can become vaccinated without an appointment, as you heard from the governor, with no insurance. But you have to take responsibility for doing this. We will only get through this if it's a partnership with the public. We need people to act now. Winter is coming, our capacity is limited, and you have to do your part. We are here for you. Just come, get vaccinated, get your booster. Can we just take a second to talk about children? We've seen surveys, 50% of parents of children 5 to 11 are reluctant to have their children vaccinated. 50%. But across the country, there have been 800 deaths of children 5 to 11 from COVID-19. We don't want to have one death here in the state of Connecticut. We need parents to do the right thing, to bring their children to get vaccinated. Thousands of children have been hospitalized. We can prevent that. We can prevent this next surge if everybody does their part. And we're here to help. Thank you.
That's okay.
All right, that'll work. Good morning. My name is Doug Houslade, the Executive Director at New Haven Parking Authority. I want to start by, since we're in the season of thanks, I'd like to thank the folks behind me who have dedicated the last 18, 19 months of their life to keeping all of us safe. We're very appreciative at the New Haven Parking Authority. We have over 100 employees. We have a vaccine and test mandate, and we're taking the disease seriously. Also, the season of thanks to our essential workers. Union Station never shut down. CT Transit never shut down. Our rail system, Amtrak, never shut down. To everyone who works here at Union Station, thank you, and thank you for helping keeping all of us safe with our mask mandates and with helping hold each other accountable to get life-saving vaccines like the COVID-19 booster upstairs. Special thank you to former Alder, the Honorable David Reyes from the Hill in New Haven, for connecting and remembering the partnership that New Haven and the state of Connecticut has, bringing our public health department from the state and local New Haven together. We've been able to provide this life-saving clinic for the rest of the year. What's important about the clinic is that it's going to be going on through all of December. It's not only the season of thanks, it's also a season of gathering together. My family had the privilege of gathering together, took the necessary precautions in getting tested, and really felt it's our own responsibility in doing everything to keep ourselves safe. My mother's over 70 years old. When I see her again next, I'll get tested again. It's important to keep getting tested even when you're vaccinated in order to make sure your family and friends stay safe. With that, I just want to thank you again for coming to Union Station. 100 years ago, Union Station opens up. Put yourself back in 100 years. We were just coming out of the Spanish flu pandemic. It was under construction during the Spanish flu pandemic. 100 years later, we've doubled down on the future of Union Station, as Mayor Elicker and Governor Lamont mentioned, expanding retail, private development to expand the station, because as we've learned in the federal level, the transportation infrastructure and the human infrastructure have to go hand in hand in order to provide the best quality of life for our residents in Connecticut and in the country. So with that, I just want to thank our public health department and our essential workers, especially those at Park New Haven. I'm seeing a few of you right now, and I'm just very grateful being able to work with you in our capacity here to serve the people of Connecticut and the city of New Haven. Thank you again. Get vaccinated. Stop by Monday, Wednesday, Friday through the rest of the year. Visit New Haven Union Station and get a shot. With that, I'll introduce the New Havener of the Year, Maritza Bond.
Thank you for letting me borrow. Listen, have to borrow something here today. Good morning. I think it's good morning time. I am really elated to be here. Obviously, many partners already have said a lot, and so I just want to keep it brief. I think for us at the City of New Haven, we made a conscious effort early on to either lead or be the conveners of partnership and collaboration. And we have demonstrated that today, that as we continue to fight this pandemic, we will continue to collaborate as public servants to be able to serve the public. And I want to, since we're in the spirit of thanks, Doug, I want to thank the community and the City of New Haven for stepping up and getting vaccinated. We're seeing our vaccination numbers. Yes, it earns a round of applause to the community because we're seeing you coming out to get vaccinated, and I want to thank you for that. But we still have much more work to do. As I look at our case rate and we continuously assess our data at the local level, what we're seeing is that 1 to 4-year-olds and 25 to 49-year-olds are the ones that are testing positive in our city. And so it is important that we know vaccines are not available for age under 5. So if you're a parent or you're a caregiver or if you're a daycare worker, get vaccinated so that we can protect the youngest that are very vulnerable, as well as those that are adult years. I know that you may have strong immune systems, but it's important to know that we do not have all the information about this new variant of concern. We want to make sure that you come out. Now, what is great about the Union Station, it is open from 8 to 3 Monday, Wednesday, and Friday. And then the health department is diagonally across the street, and we actually have evening clinics. So as commuters are coming back into our city, or we have other locals that are riding the bus, please go right across the street to the health department on Thursdays and Fridays. We close at 7 o'clock. And to further that, because we're all about access and equity in our city, our vaccine partners are open 7 days a week. Our Griffin Hospital are offering vaccines on Saturdays and Sundays at the Long Wharf Clinic. So there is no excuse. Come out, get vaccinated. We're seeing community transmission. And as we gather together, let us gather together safely and get boosted so we can be protected. Thank you so much.
Let me just ask if there are any questions. Yes, Doctor. Sure.
So we know that there is a family that was affected, and so there are other members of the family that are in the process of being tested. A few have been symptomatic. So whether it's actually Omicron or not, we don't know that yet. But I think it would be fair to assume if there have been already 2 people of one family and there are other members of the same household, that it likely will be the same.
How concerned are you about how quickly Omicron?
Look, I'm concerned about COVID overall. That's my job. I'm supposed to be concerned about COVID and where we're headed. And we know that we are seeing a rise in cases, but I will tell you again, the severity of disease that we're seeing right now in the hospital is still the Delta variant. What we don't know about Omicron is whether it will be more severe or less severe. That is still remains to be seen. We know right now that some of the cases initially appear to be more mild. Now that could be because these are vaccinated people who we have identified it in. Again, that's a win for the vaccines. We don't know what that manifestation of disease might be like in unvaccinated people. And again, the vast majority of what we see in our state is still the Delta variant. If we, for some reason, find over time that Omicron, which does appear to be more infectious than Delta, it does seem like that right now, we will notice that over time as we do our sequencing and we identify what types of variants are circulating through the state, which we do on a regular basis. Right now, it's almost 100% Delta. If we find that Omicron starts overtaking a little bit more, we'll start to understand whether it is that it is more infectious than the Delta variant. And if it turns out that it actually is less severe in disease, that would be welcome news, actually, right? But there's so much we don't know. What we know right now is the Delta variant is still the predominant strain, and it is still causing severity of disease in many people, particularly the unvaccinated. But if you have not gotten your booster, I know it was confusing for a long time. Let me be crystal clear. Anybody 18 and older is eligible for a booster if you've been 6 months out, which most people 18 and older have been since their initial booster shot. Go out and get boosted. It is the #1 way you can protect yourself additionally as we see a surge in cases. Governor is not here. Okay.
Connecticut was really one of the highest states in getting people vaccinated, but it's been a lot farther behind in getting people boosted. Why do you think that is, and what are you doing to, besides what you just said, to get more people to get their booster?
I think there are a few things that we can notice. If you see the states that were ahead of us in boosters, they were places, first of all, that were surging in cases, by and large, right at that moment. And there is no motivator for protecting yourself greater than fear of infection. And so many of the people who lived in states where they saw a surge in infections, I suspect, went out and got their booster because they saw the benefit of it. They saw the reality of why getting a booster might help them. The messaging around this, the eligibility criteria, I understand that's been confusing, but that's been confusing for all Americans. Now it is clear. But I do believe that the surge in cases in some of those other states did motivate people to act a little more aggressively earlier on. Now that we too are seeing a surge in cases, we here in Connecticut hear that there are a lot of people looking for booster shots. We have examined this over and over again with our various partners that are giving booster shots. And yes, you may have some challenges at various different pharmacy partners, but this is why we are making sure people know about our DPH resources, local health department resources, all other partners that are also involved in the booster effort. So look at all of them, go to ct.gov/COVID vaccine, look for DPH vans, where they might be in your community, put in your zip code, you'll find pharmacy partners and others, and we are trying to make it as easy as possible. Look at your local health department, what they are doing for you, and what they may have just around the corner from you. And in our examination of this, there are plenty of vaccine appointments available out there. And whether it's appointments or just a walk-up like we've got here right in this train station, take advantage of those opportunities.
Could I just add to what the commissioner is saying? So you asked what the governor and our administration are doing. Well, we are here and getting the message out that it's important for people to get booster shots, especially since a lot of our vaccinated people's immunity is waning, and we know we're going into flu season and the Christmas holidays and time when people are gathering at New Year's. And so we will be, the governor and I and the commissioner have made it a priority from now to the end of the year to be going around the state and encouraging people to get vaccinated, to get boosted, to get parents to vaccinate in the 5 to 11 age group to keep our kids safe. And we are doing that with a laser focus on equity as well, because there are so many booster clinics going on right now at public health departments in places, high traffic places like this. There really is no excuse. It's free. When I went to a clinic at the Cromwell Town Hall, they vaccinated hundreds of people, but I had no wait. I was able to just go right in without an appointment. So there should not be a lot of challenges. Please, please, please get your booster.
Yes. Question? No, I want to ask the commissioner as well to repeat, vaccines.gov, places where people can get the information that they need in order to be able to get the vaccination. So go ahead. I will do that, please.
So first, just to reiterate the website, ct.gov/COVID vaccine, and this is where you can find all different vaccine locations throughout our state, in addition to all of those that our DPH vans are providing. And you can find all of that information on this website. Now, to your question, we are very committed to the idea of an electronic app that can be utilized to show just that, your vaccine status. We are working on that to be able to roll that out in short order. And I think then in different institutions throughout the state will have the opportunity to decide how they're going to use it. Okay, was your question on whether we should repeat masks?
I'll just say that the governor has thus far allowed municipalities to make a decision, and we continue to monitor every day to see if we need to take further measures, but we want people just to use common sense. We're coming up on flu season. There's a new highly communicable variant. The best thing to do when you're out in public is to wear a mask.
Thank you, everybody. We have time for one more question. Well, it's a toss-up. Two more questions, very quick one.
from the data that I've seen so far, what we're learning is that it seems the Omicron variant is about 10 times more transmissible than the Delta variant. Secondly, most of the cases that at least I've seen so far coming out of South Africa have been younger people, many of whom were unvaccinated. Severity of disease, I think, really is an open question. There have been, again, some anecdotal reports of milder disease, whether that's in vaccinated people, whether that's in unvaccinated people. Again, they have used largely other types of vaccines. There's only 25% of the South African population that is vaccinated. So there's so many different things. They're using AstraZeneca and J&J predominantly, versus predominantly in the United States we've had Moderna and Pfizer vaccines. There are a lot of unknowns. What I would say overall that I've seen that's probably the most interesting piece of information so far is the transmissibility that is about 10 times more than Delta. But I think severity of disease, what people are going to look like, because again, if mostly younger people were infected in that cohort, we don't know how that would apply to older populations, people who are vaccinated. A lot of questions still remain to be answered. Last question? Our goal is to capture anybody and everybody and make it easy, okay? So we have not been tracking exactly what the travel status, whether they're local, whether they're going internationally, or what they might be doing. But at the end of the day, if people remember when they're traveling, they're getting into situations where they're going to be around a lot of people, they're going to destinations where they're maybe around people they don't know. At the end of the day, we want to make it as easy as possible for people who are either coming to our state or leaving our state to be protected. So these are not the only places where we have clinics. We have clinics all over. This is just another avenue that we are trying to tap into to make it as easy as possible for people to have access to these vaccines. Okay.
Thanks, everybody.
Thank you.